Hello students, welcome to this lecture. Protocol, schedule, randomization and drug assignment. So this is where everything starts, right? Screening would have been done 20 days earlier, and then if the patient is eligible, 20 days later you do randomization or drug assignment, right? So if the innocent patient is eligible, then the patient gets the drug or the placebo. He or she doesn't know which one it is. So here is a timeline snapshot of the visit schedule. So screening happened 20 days earlier, and then randomization or drug assignment happens 20 days later. Cycle 1, day 1. So on day 1 happens 20 days after screening. So screening happened on 7th January and cycle 1, day 1 happens on 25th January. So it's plus or minus 20 days. It can change. And then randomization in cycle 1, day 8. That's the cycle 1 mini visit happens 8 days later on 1st February 2019. And cycle 1, day 15 happens another. So that's 15 days, right? 15 days from cycle 1, day 1 happens on 8th February 2019. That's on a Friday. So this is good. The patient is free on Fridays to come for this visit. So that's how they schedule, right? The coordinator will look at a calendar and speak to the patient and actually schedule the visits using the protocol, right? And then she will prepare. So let's look at what are the assessments done at cycle 1, day 1, randomization, right? So randomization, that means you use a computer algorithm and see whether the patient is assigned to the drug or the placebo. However, the doctor, nurse or the patient wouldn't know which group they are assigned to. It's blinded, right? And then you do drug dispensation. So after randomization, obviously you give the drug so the patient can take the drug. Then you do physical examination. So that is to see the physical status of the patient at baseline before giving the drug, right? Look at vital signs, that is temperature, pulse, blood pressure and so forth. Then you do ECOG performance, that is a standardized assessment of patient's functionality, right? Then hematology, chemistry, that's to see the red blood cell, number of red blood cells, white blood cells, platelets, that means blood function. And then blood chemistry in terms of sodium, potassium, ALT, AST, which are markers of liver damage as well. Then you do ECG. That's to see whether the patient has cardiac arrhythmias at base. And you do pregnancy test. Obviously, you do this only for female patients of childbearing potential. So this is a clinical trial drug. So you don't want any effect on the fetus, right? So this is an exclusion criteria. That's why you do a pregnancy test, insulin, urinalysis. Let's look at day 8 and day 15. So day 8 you do only two things: physical examination and vital signs. That is to see after the patient is given the drug 8 days later whether they have an effect on their drug or on their body or the vital signs. So you also do then you look at day 15. So what are the assessments we do at day 15? You do physical examination, vital signs, hematology, chemistry, insulin, and so that is to see, after giving the drug 15 days later whether it has an effect on the patient's body, the patient's blood, the patient's diabetic status and so forth. That's why you do those assessments at day 15. The end of randomization and drug dispensation. To summarize, you did screening 20 days earlier, 20 days later you do randomization and drug assignment. It's drug or the placebo the patient is assigned to, and but we are blinded, nobody knows which group it is. And then you do a series of tests at randomization and drug assignment to see the baseline level of the patient in terms of his or her body function. Then you do day 8 and day 15 to see how the patient is doing after giving the drug. So that's the end of cycle 1, randomization and drug assignment. Next we go to the repeating cycles and end of treatment, visit and follow-up. Ciao for now.